In fact, you never conceive in your life, and you always bleed during your menstruation. And the only cure for fibroid is hysterectomy, and fibroid only happens in the uterus. These are many more myths or lies you know about fibroids are things I'm going to debunk in this particular live. So anyway, you're watching me. Hi, hello. My name is Nurse Amara Chuku, and I anchor this page. Yeah, my handle Med-Xposé. So in Med-Xposé, we basically talk about everything related to reproductive health, sexual health. So sit put, let's debunk 20 myths around fibroids. Yeah, so the first myth around fibroid I'm going to debunk is this, that it's only women above 40 years that can get fibroid. That is a very big fat lie, because the truth is, once you've attained reproductive age, once you've reached reproductive age, you are, let's say, predisposed to getting fibroid. Because what exactly causes this fibroid is the upsurge, or let me say the roller coaster that happens with your hormones, your reproductive hormones, is actually what causes this fibroid. The estrogen, the progesterone, they're ups and down in the body, and these hormones, they don't come into play as such if you've not attained your reproductive age. Yeah. So if you are in your reproductive age, you being reproductive, you attaining that reproductive age is already a risk for having fibroid. So if you are 20, you can have fibroid. If you are 25, you can have fibroid. If you are 30, someone who is at 30 can still have fibroid. So it's not just women of 20 years and above that can have fibroid. Yeah. So number one myth debunked. So wipe it from your head, from your brain, anywhere. So it's not just women of 40 years and above, it's not just women of old age that can have fibroid. So even if you are 20, even if you are 30, you can have fibroid. Okay? Oh, hi, Aurora Gregerson. Welcome to my live. I'm talking about fibroid. I want to debunk. I'm not Samarachko, by the way. And on this live, I just want to debunk 20 myths that people believe so much about fibroid. Alright? 20 myths people believe so much about fibroid. And the first one I've said is, the first myth I've debunked is people of 40 years and above are the only age range or age brackets that get fibroid. And I'm saying it's a big fat lie. Research has been done. So many underground studies have been done. People have been researched on, and science found out that it is not just people of 40 years and above. It goes beyond 40 years and above. Melanie, thank you so much for joining my live. I hope you get value sitting on this live. So the next myth, number two myth, if you're joining now, I'm just talking about fibroid. The number two myth is this. Where is the people at? I don't get that question. But the number two myth of fibroid I want to debunk is fibroid will always give you symptoms. That is a very big lie. Fibroid will not always give you symptoms. Some people have fibroid and they don't even know they have fibroid. They do not know. Like, these symptoms of bleeding, doing over bleeding, so heavy bleeding, not seeing your period at all, and all the signs and symptoms, always having so many having dysmenorrhea, cramps during your period. Some people don't feel that. They have normal period, they have normal bleeding, they don't feel such at all. So some people don't have symptoms of fibroid. They only know that they have this fibroid when they've gone to the hospital. They must have gone, they maybe just walk into a hospital, you are sick, and You don't have your period, you don't have your period. Please, can you put your question properly so I will be able to answer you, okay? Is it that you've attained age of period, Melanie, and you've not seen your period? Just put your question properly so I'll be able to answer you. So some people, like I was saying, some people don't have these symptoms. They don't experience the symptoms of heavy bleeding, cramping during period, but here they have fibroid. And most people find out they have fibroid when they go to the hospital for another thing, another scan at all, another scan. They went to the hospital for another thing, and that is when they see that they have fibroid. Some people notice, the doctors notice they have fibroid during cesarean section, because most fibroids, they happen in the uterus. We also have cervical fibroid, but majority of fibroid that we see in the hospital are uterine fibroid. Are the ones that happen either close to the uterus, the ones hanging by the uterus, or the ones surrounding the uterus, or the ones inside the uterus that will even block where the baby is supposed to sit. So some people do not see these symptoms of cramping, dysmenorrhea, pain, nausea that comes with fibroid. They experience a normal period and they go about their way. So the third one is, many people believe that fibroid is cancerous. That's a very big lie. Fibroid, in fact, the definition of fibroid says that fibroid is a benign growth. Benign means it is not cancerous. So if you're having fibroid, don't be scared. You don't have cancer. It is not cancer you have at all. Fibroid is different from cancer. Cancerous cells, they metastasize, like they grow rapidly. Fibroid can stay in your body for years. You wouldn't even know that you have. Okay, the life is about fibroid. Melanie, I don't know if you're hearing me, but the life is about fibroid. I'm talking about fibroid. What people believe so much about fibroid that are lies. Yeah. So I'm in the number 3 points. The first one, I've said that not only women of age 40 years and above can have fibroid. And number 2 is fibroid. Not all fibroid will give you symptoms. Hi Melissa, welcome to my life. I'm talking about fibroid, okay? So it's not only most women that have fibroid don't have symptoms. And I am on the third point, which I said fibroids are not cancerous growths. You see this idea that a lot of people believe that fibroids are cancerous. If you have fibroid, you already have cancer. That is a very big lie. You don't have cancer when you have fibroid, unless otherwise proven. Unless maybe later on that fibroid develops to be cancerous. But if not, that fibroid is not cancerous. Fibroids are not cancerous cells. They grow out of the normal tissue of your body. The only problem that most people have is it stops them. Sometimes it's obstruct, like it sits in your uterus or in your womb. You won't be able to have a baby. Like a baby won't have a place to implant. That's when it becomes a very, very threatening, or when it gives you a lot of bleeding. That's when it becomes a very, very threatening problem. But aside that, fibroid is not cancerous. So whenever you hear someone saying fibroid is cancerous, please debunk it. It is not cancerous. Fibroid are benign tumor, like they are benign growth that develop in the body. Now we have said the fourth myth. Okay, I've done 1, 2, 3. So the fourth myth is this: many people fear a lot about fibroid, that the only thing they have in their mind that is the cure or the treatment of fibroid is removal of the womb. Like I said earlier, fibroid can also have it. We also have cervical fibroids. So it doesn't just happen in the womb. We have cervical fibroids, right? So cervical fibroid, the treatment will be removal of the uterus. So not all fibroid needs you to remove your uterus. No. Some fibroids, you can just remove them and you're fine. And there is no need for removal of the uterus. Okay, so most people think that fibroid, you only have to remove your uterus to cure fibroid. That is a very big lie. If the fibroid is not necessitating anything that will lead to hysterectomy, that is removal of your womb, there is no need there is no need of you, or there's no need of the surgeon or the surgical team removing your womb. There is what is known as myomectomy, that is removal of the fibroids from your womb or anywhere it is growing. So you will not need to remove your womb if the fibroid is not really disturbing, or if it's not giving the surgical team or your general practitioner any concern for that. Especially for those who still want to have kids and they need the fibroid removed, the uterus will not be touched unless it becomes a life-threatening problem. Unless it becomes a life-threatening problem before they will need your uterus to be touched. Aside that, there is no need. It is fallacy, it is a myth, it is a lie to tell someone that the only cure they have or they will need for their to treat the fibroid is hysterectomy. That is a lie. It is not just hysterectomy. You can do other treatments. There are other non-surgical treatments of fibroid that can spare the uterus and not removing the uterus totally. So the number five myth about fibroid that I would love to debunk is this: that once you have fibroid, you won't be able to get pregnant. No. If you have fibroid, you can have as many kids as you want. Yes. You can still have that fibroid and have as many kids as you want. You can decide to not give birth any longer if the fibroid is disturbing you. But having fibroid does not mean you will not be pregnant. Like I said earlier, some fibroid, they develop on the cervix. Some are around the womb and not inside. Most fibroid that stops people or that gives people difficulty conceiving are those ones that are inside the endometrium, where the fertilized egg that is going to form the baby sits, where implantation takes place. Those ones that sit where the baby is supposed to be implanted, these are the ones that will disturb conception, or the ones that mostly sit on the cervix. Aside these ones, there are just limited fibroids that can make you not to get pregnant. So fibroids are the ones that hang around the fallopian tube. So having fibroid does not mean you won't be able to get pregnant. No. Having fibroid does not mean you won't be able to deliver your baby. Having fibroid does not mean you won't have your own child. You won't be able to conceive any longer. So having fibroid does not mean you will just not be a mother or you won't have your baby. No. So debunk that myth that once you have fibroid, no matter the size, no matter whatever, provided is you've been diagnosed of fibroid, that you're not going to have your baby. No, you are going to have your baby, and the fibroid will be removed, and the treatment, you commence your treatment. We've had testimonies in the hospital where women that have had fibroid, they've taken so many herbal concussion, they never knew that we have treatments for fibroid, and they've taken so many concussions for fibroid, and at the end they were not able to conceive till they got the appropriate treatment. Till they came to the hospital, they got the appropriate treatment for fibroid, and they were able to conceive. So debunk that myth that once you have fibroid, that you're not going to conceive. No, you can still have your baby, you can still get pregnant and still have as many children as you want. So fibroid does not stop you from getting pregnant. It does not stop you from conceiving your baby. It does not stop you from having your own child. Okay, so that's the fifth myth. So because most people believe that once you have fibroid, it has finished for you. But no. Okay? So the sixth myth I have about fibroid is fibroids shrink on their own. No. Fibroid don't just go, it doesn't disappear. It's not something that comes in your body like a growth that happens in your body and it disappears. No. Fibroid can not shrink on their own unless a treatment is given. Now, how do the treatment that pertains fibroid shrinking is this? The treatment that really happens is this: the surgery that is going to make it not that will allow the fibroid to shrink is they deprive it. The surgeon will look for a way to deprive the fibroid blood. That blood vessel that feeds the fibroid will be reconnected to another place, to another part of the body, so that the fibroid will be deprived of blood and it will shrink. So fibroid does not shrink on their own. Sometimes the surgeon will, the doctor, your general practitioner, or whoever that is caring for you, the medical practitioner will say, okay, let's use hormonal therapy. There are some hormones that will cause deprivation of blood to the fibroid. So fibroid does not shrink on their own. It does not just disappear. There has to be something to be done for the fibroid to shrink. Okay, so the seventh myth that I have is this: birth control pills. So many people believe that birth control pills that they cause fibroid. Now the truth is that is not completely true, because birth control pill does not cause fibroid. In fact, they help even to manage it. Yes, some are hormonal therapy. Some birth control pills, in fact, all the birth control pills that we have in the pharmacy, they are hormonal based. What do I mean by hormonal based? They contain hormone that will help the body. And these hormones are necessary. These hormones are necessary for you, like the estrogen, the progesterone. So these hormones are what is implanted in the birth control pills that ladies take, and they don't cause fibroid. So if you're having the mindset, if you're looking for a contraceptive pill or a contraceptive measure, and you are being told, this birth control pills is going to cause fibroid, that's a very big lie. It does not cause fibroid. It helps also to manage even the symptoms like the cramping that you have that comes with fibroid, the dysmenorrhea, the heavy bleeding. These birth control pills, they rather helps to manage the symptoms of fibroid than causing fibroid itself. So next time someone tells you birth control pills causes fibroid, that's a very big lie. Maybe on another day I will talk about the effect of birth control pills and what they can do and what they cannot do. But just know that fibroid is not caused by birth control pills. So that is the myth number 7. Let's go over to number 8. The number 8 myth is this: many people believe that for you to get to be free from those symptoms, that the fibroid has to be removed. No, like I said earlier, some of these hormones, they help to divert blood flow from the fibroid, and not all fibroid needs surgical intervention, not all of them. So sometimes the fibroid might not need to be removed, and you'll be okay. Mark Jordan, ask your question, I will answer you. Just drop your question in the comment section, I will answer you. Thank you for joining, by the way. Thank you so much. So like I was saying, fibroids, not all fibroids need to be removed. If it's not disturbing you, if it's not causing any life-threatening problem for you, there is no need for removal. You even be advised in the hospital, don't stress yourself going under the knife to remove the fibroid. Most fibroids that are removed are those ones that are life-threatening, those ones that are embedded, that their growth is happening inside the uterus, like inside where the baby is supposed to sit and grow. So those ones, obviously, they won't allow the baby to develop very well. They will be a threat for the baby or to the baby, and you'll be advised that it be removed. Okay? But you see those ones that are not disturbing you, no symptoms, nothing at all, you may not need it to be touched. So not all fibroids need to be removed. Don't think that before you can conceive, if you have fibroid, that you need to remove it. Some women have this fibroid, they conceive and they have all their babies. Yes, they have all their babies. Okay, so you may not really need that surgery to have the fibroid treated. You may not need fibroid to be removed for you to be pregnant. Okay, so yeah, that is the myth number 8. Not all fibroids need removal. Now let's go to myth number 9. Yes, this particular one. So many of us, we really believe that. Some people think that fibroid is just for overweight women. That once you are obese, once you are fat, that slim women, those figure 8 ladies, they don't have fibroid. Like, fibroid is not for them. Let me bust your bubble. Fibroid is not just, don't just happen to obese women. It doesn't just happen to obese women, because the thing about this fibroid is that it has to do with your hormones, and people who are dealing with hormonal imbalance, most often they battle with fibroid. Yeah, they end up battling with fibroid because, like I told you earlier when I started this life, it is the roller coaster happening in your hormones, your reproductive hormones, that actually engineers this fibroid. Without those hormones, this fibroid have 99.9%, not like the probability of it not happening is 99.9% without these hormones. So it's actually these hormones that engineer, that gives it power to grow. Okay, so don't think it's just overweight ladies or people who are fat or people who are big size that can have fibroid. Whether you are slim, whether you are chubby, whether you are big, whether you are small, whether you are short, tall, you can have fibroid. Fibroid is not meant for any particular race, it's not meant for any particular figure, it's not meant for any particular weight. Yes, fibroid can happen to anybody at all, any woman at all. So debunk that like that we have that, fibroid is just for those who are fat. No, fibroid can happen to anybody, any woman at all. Okay, so even though that weight is implicated, because those who are obese or who are overweight, one thing with them is that they always have a problem with hormonal imbalance, because those fatty cells don't really know how to manage hormones. Yes, that sometimes their estrogen level goes high, influencing the growth of this fibroid. So let's say this fibroid is supposed to be small, but in a fat person or in an overly obese person, the fibroid might grow faster because of the hormone estrogen that is more abundant in their body. No thanks to the fats. So yeah, the fats influence it, but that does not mean that it is only obese women that have fibroid. So like I said earlier, whether you are slim, whether you are short, whether you are fat, you are predisposed to having fibroid. Fibroid happens to women of reproductive age and not just fat women. Okay? And number 10 of the myths I have to debunk today, like I said, I have 20 myths about fibroid I want to debunk on this live, and that's why I'm doing this live. The true or false matters surrounding fibroid. Okay, so the number 10 myth is people believe that your diet, your feeding does not have any role to play in fibroid. I want to laugh first. No, what you eat, if you're already diagnosed of fibroid, what you eat somehow influences eat. Now imagine that you were slim and you were diagnosed of fibroid, and you're not taking care of your diet, you're not taking care of your body, and you started getting fat. In fact, you grew fat that you became obese. Remember, those fats, they encourage the upsurge of estrogen, a very important hormone that encourages the growth of fibroid. So your diet directly or indirectly affects the growth of the fibroid. So if this hormone estrogen is in abundance in your body, fibroid is going to, the growth will be rapid. Okay, so what you eat, you manage. Someone who is having fibroid and who is obese, first thing we always advise in the hospital is your weight. You need to reduce your weight, because without the reduction of your weight, no matter the level of drug, the therapy we are giving, it will be affecting the therapy or the treatment or the management. So you will need to work on your weight. Mark Jodasin, I'm still waiting for your question. Okay. Zahara Magaji, hi, welcome to my life. I am talking about fibroid, the true and false that people believe about fibroid, the myths. I'm debunking 20 myths about fibroid, and I'm at the point number 10. And I said that your diet has a role to play in fibroid. Yeah. So in fibroid management, don't think once you are taking drugs or you're being placed on hormonal therapy, you don't need to take care of yourself. You don't need to watch what you're eating. You don't need to do your exercises any longer. No. If you're being managed of fibroid, you need to watch what you eat so you don't get overly out of the board. Okay, you watch your weight, you watch your diet, you reduce your red meat, your fat, and increase more of fiber so that you can reduce those fats that are being converted into estrogen that supports the upsurge of estrogen. Remember, estrogen enables the growth of fibroid. Okay, so eat more of leafy greens, food filled with fiber, to help keep you in shape, to help keep you in that weight. All right, so that is the 10th myth. Now the 11th myth is this. I think the 11th myth, I've said it before in one of the points. I kind of imputed it in one of the points I raised before, and that is you always need surgery. So many people believe that once you have fibroid you must do surgery. No, some women have this fibroid, like I said earlier, and they go about deliver their children and have everything, like they have the number of kids they want without any issues at all. Okay, without any issues at all, they go about having their kids without any issues. They conceive, no problem at all. All right, so fibroid is not just, you must not need surgery to treat fibroid. If it's asymptomatic, if it's not disturbing you, if it's not showing any symptoms and it's not affecting contraception, there is no need for it. If it's not threatening your life, there is no need for the surgery. So not all fibroid needs surgery. Not all fibroid needs you to go under the knife. You must not go under the knife. Okay? So don't insist when your doctor is telling you this fibroid does not need surgery. You can go about and have your kids without its interference. So because not all fibroids happen inside the womb. Some are outside, like I said, some hang around the womb, and they won't disturb your delivery, they won't disturb your baby, they won't disturb contraception. So not all fibroid needs you to go under the knife. So if the doctor advises you that you don't need to go under the knife for this fibroid, please just have your children, have your baby, conceive and get pregnant, do your baby born, do everything you want to do, and just let it out of your mind. The fibroid will not affect you if the doctor says so, and if there is every evidence that it is not inside your uterus, okay, and it's not blocking your cervix too. So that's myth number 11. So myth number 12 is this, that fibroids grow back after treatment. Yeah, this particular one, a lot of people believe it because we've seen cases where after fibroid surgery, the lady will come back a few years later, and we will see that through the scan, this will other ultrasound scan, that the lady is having another growth of fibroid. Now the truth is, the fibroid regrowing does not mean it is at the same place. That one that has been that was removed, the one that you had surgery for, those fibroids did not grow at the same spot again. So can fibroid regrow? It cannot really regrow in the particular spot where it has been cut off before. Okay? So new ones are the ones developing, and not like the ones that were removed came back again. So fibroid can the regrowth of fibroid does not mean it is the same fibroid that was removed that is growing again. You can remove fibroid inside the uterus, and the next time that a new one is developing outside. That doesn't mean that the surgery that was done before was unsuccessful. No. You can do a fibroid surgery, and later on it can still, like, the fibroid can still grow again, but not at the same spot, not at the same place. Okay, so debunk that myth that there is no need for surgery, that once you do fibroid surgery it's going to come back. No, not all fibroids, some don't even grow again. Okay, and that is why it's important to manage your weight, to take your management, to take your treatment very, very serious. All right, so number 13 myth, another lie that people believe so much, is that it is only black women like me that have fibroid. The truth is, whether you are fair, whether you are Caucasian, whether you are a black person, whether you are a white person, whether you are American, Russian, Germany, Spanish, Italian, Nigerian, Cameroonian, Ghanaian, you can have fibroid. Yeah. So it's not just black women, both African, both white, both American can have fibroid. So it's not just black women. So there is no race that cannot have fibroid. Fibroid is not devoid of any race. Yeah. Fibroid does not it's not selective to those it happens to. Fibroid happening to any woman is not selective, not because the woman is black, not because, no. Like I said, most fibroid develop because of the hormonal issues that women have. Okay, so number 14th myth is this: the fibroids are caused by stress. Yeah. The truth is, science says that stress does not directly cause fibroid, even though it affects its symptoms. Yeah. But it does not directly cause fibroid. Stress does not make fibroid to start growing. But stress can affect your hormones, okay, that will facilitate the growth of that fibroid. I don't know if you get me. Stress on its own does not cause you to have fibroid, but it can facilitate, it can enhance the symptoms. So when you are being diagnosed of fibroid, you also need to limit your stress level. So it will help to manage you very well. Okay, so stress on its own does not directly cause fibroid. You are stressed, not because you are stressing yourself, you will not say, I'm going to have fibroid. No. So stress on its own does not cause fibroid. Yep. So I hope that is taken. So that is a fact. Stress, that is the truth about it. Stress on its own does not cause fibroid. Okay. Now the 15th one, yeah, I'm almost at my 20th myth. So the 15th myth is this: that fibroid is contagious. I don't know where we are getting all these lies from, but I've heard someone say that once you stay with someone who has fibroid, that you might start having fibroid. That's a very big lie, because fibroid is not infectious. It is not contagious. It's not some water or airborne disease or bloodborne disease like that. No. Fibroid is not contagious. Okay, fibroid does not is not transmitted from one person to another. It's not that type of diagnosis, no. So fibroid does not cause one to have fibroid. Like, maybe let me say my roommate has fibroid, and then I'm going to get fibroid because she has fibroid. No, it's not contagious. Fibroid is not airborne, it's not bloodborne, it's not waterborne disease. So if you have fibroid, that doesn't mean you're going to transfer it or transmit it to another person. No. So it's not contagious, okay? They're not infectious, they're not contagious. They're just a result of sometimes genetics and hormonal levels, like I said. Okay, so that is myth number 15. Now the myth number 16 is this: that fibroid always keep growing. No. The truth is, when you've attained your menopausal age, like a woman who has attained her menopausal age, when you've attained that age, your estrogen level will start going into the decline level. Yeah, it will start declining, and that estrogen declining will cause the fibroid to shrink. Okay, like I said, remember, it is your estrogen that helps the fibroid to grow very well. So if there is no estrogen, the fibroid will start shrinking, and that is one thing that hormonal therapy does for you. So this hormonal therapy deprives you of estrogen. They give you more of progesterone, so that your estrogen level will go down, and the fibroid will kind of shrink. So yeah, fibroids are not always growing, even though they grow. But when you attain your menopause, it won't that growth won't be there any longer. Okay. So number 17th myth is this: so people believe that once you have fibroid, you feel them in your body. Like once you touch your abdomen and you feel that you have fibroid. No, you cannot. Most fibroids cannot be felt in the hand, like by just touching your body. Most fibroids cannot be felt. Like you don't just touch your body and feel fibroid. No, it doesn't happen like that. So it doesn't happen like that. You need an ultrasound scan. You need to go under some examinations, under radiological examinations, to see the fibroid, to know their size, to know where they are located, to know if it's in the uterus, if it's in the cervix, to see all those things. So fibroid are not felt in the hand like this. You can't just do palpation, you can't just palpate a person and you start feeling fibroid like that. So you on your own, you may not feel it. Okay, you may not even know that this is fibroid. Alright. So yeah, debunk that mean that you can feel fibroid, like with you just touching your abdomen, you feel that maybe if it's strong, you feel that you have fibroid. No, it doesn't happen like that. Okay. So number 18th myth is this: some people believe that PCOS and fibroids are the same thing. They are not the same thing. PCOS and fibroids are not the same thing at all. They are different things altogether. Okay? So fibroids and PCOS are not the same thing. Alright? So cyst happens in your ovary in PCOS. Cyst happens in your ovary in PCOS, and those cysts are like, let me use a balloon for example to demonstrate, to show you how, to tell you how so I can show you how cysts are. You get a balloon, you fill it with fluid and some other things that looks like pus. So that is what cysts are. They are not fibroid, and fibroids are not cysts. So if you're having PCOS, that doesn't mean you have fibroid. And if you're having fibroid, that doesn't mean you have PCOS. PCOS, polycystic ovary syndrome, are different from fibroids. Fibroids, if you see fibroid, they look a bit muscular. They're not the same thing. Okay, so fibroids and PCOS are not the same thing. Cysts are cysts, fibroids are fibroids. Cysts are fluid filled, like it is pus filled. Let me use that word, pus filled. But fibroids are kind of muscular in nature. Okay, they can be calcified, but cysts cannot be calcified. So PCOS and fibroids are not the same thing. They sometimes mimic their symptoms. Okay, someone who has PCOS can also have painful menstruation. Someone who has fibroid can have painful menstruation, can have menorrhagia, that's bleeding, heavy bleeding during periods. Okay, but that does not mean that it is the same thing. Cyst happens in the ovary. Fibroid does not happen in the ovary. Okay, that's why it's called polycystic ovary syndrome, the location where it is happening is in the ovary. But fibroid can only happen in the uterus and in the cervix. So having PCOS does not mean you have fibroid, and having fibroid does not mean you have PCOS. I hope that is clear enough. Okay, so that is the myth number 8. And like I said, there are different conditions. PCOS is a different condition from fibroid, and fibroid is a different condition from PCOS. So they are not the same thing. Okay, now the myth number 19 I have to debunk before I leave this life, or before this life goes off, is this: that fibroid cause heavy periods only. So people think that once they have heavy periods, that means they have fibroid. That's a very big lie. There are so many other diseases that can make you to have heavy periods. Sorry, like endometriosis, endometriosis, PCOS, cervical incontinence, uterine incontinence. There are so many other things that can implicate heavy periods, and not just fibroid. So having heavy period that's not the only symptoms of fibroid. So when you have heavy period and it's consistent with your period, I will advise you go for further investigation. You go to the hospital to have further investigations. This investigation will help you to know, okay, oh, is it fibroid? Is it not fibroid? Is it? So what exactly it is, okay? So heavy period is not the only sign, okay, of fibroid. So yeah, when you have heavy period, please don't ignore it. It's one of the signs, but that's not the only sign. Don't ignore heavy periods. They can mean a lot of things. We have PCOS, we have cervical incontinence, we have endometriosis, we have endometriosis. So there's so many things that can cause heavy period. So don't feel that it's fibroid. I already know it's fibroid. No, you don't know it's fibroid till it is proven by the doctor or by other investigations that it's fibroid. So not all heavy periods is fibroid, and not all fibroids can cause heavy period. The other symptoms of fibroid, like pain, frequent urination, bloating, you start having bloating, you start having constipation, and overall is infertility. Like I said, even though fibroid can cause infertility, but not all that have fibroid are infertile. Okay? Yeah. So let that be clear. Not all that have fibroid. You can still have fibroid and have your baby. Yeah, you can. So the last myth that I will debunk on this life, is this. So people believe you have to wait till menopause for you to actually treat yourself of fibroid. No, you don't have to wait. You don't have to wait till you attain the age of menopause to treat yourself of fibroid. If this fibroid is life-threatening, if it's disturbing you from having a baby, from getting pregnant, please seek help and seek management. If it's causing infertility, please seek help. Don't wait till menopause for you to treat that fibroid. Don't wait till fibroid causes a different problem, causes you your marriage. Okay? Like I said, The fibroid is not your fault. That you have fibroid is not your fault. The symptoms you're having is not your fault. So don't feel that this fibroid I'm having is my fault and I have to wait till menopause. I have to suffer myself till I attain menopause. No. If you're a lady watching this, please, and you have anyone that has been diagnosed of fibroid, please reach out to them. They should know if this fibroid is actually causing issues, if it's causing infertility, if it's obstructing, if it's preventing you from getting pregnant, if it's actually causing you heavy bleeding that is already life-threatening. Please seek help. Seek help. Go to the hospital so that you'll be well managed. All right? So these are the 20 myths I have about fibroids. So if you watch to this point, if you watch this live to this point, if you're in this live to this point, and you have any question, I will be waiting for you. So I want to take some time and thank my top fans. Aurora Gregerson, thank you for joining me. Melanie, thank you for joining me. Melissa, thank you. Mark Jodasin, Zahara Magaji, thank you for joining me. Yeah, thank you so much. Thank you so much for joining me. I really appreciate this. I really appreciate. So yeah, thank you very much for everything. Thank you for joining me. So I'll be going out now. I spoke about, if you're joining now, this live is about fibroid. I'll post the highlights so we get to see 20 myths that has to deal with fibroid. So I've debunked 20 myths. I've given you the facts, science backed. Yeah. So again, if you have fibroid, that doesn't mean you can't have a baby. Doesn't mean you have to go through surgery. Doesn't mean that the only treatment is removing your womb. You may not need your womb to be removed and you still have your baby. Alright. So I still remain your nurse, Nosamara Chiku, and welcome to my handle. If you're new on this handle, welcome. Thank you so much. I'm a God girl. Yeah, I'm a God girl. And I love to talk about this handle. It just basically from reproductive health, sexual health, for God. So like I said, I am a Christian girl. So yeah, I love to post, I love to talk about God. And you see some of those things in my shorts, right? So yeah, so these are the 20 myths I have about fibroid. Thank you so much, guys, for joining. I really appreciate, and I'm so grateful that this live happened. Thank you. Bye. See you in my next live, same time tomorrow. Yeah, I'll be here to talk about another amazing topic. Till then, tomorrow. Bye.